Well, as the globe marks World Rabies Day, the KwaZulu-Natal Department of Agriculture and Rural Development is rolling out a massive vaccination campaign. This after rabies claimed the life of a 2-year-old in Bhamshela, north of Durban. Mr. Khaye Nkwanyana is the Provincial Department spokesperson. He joins us now from our Durban studios. Good afternoon, Khaye, and thank you for your time on the SABC News Desk.
Thank you very much, Stephen.
How serious is this latest outbreak of rabies, and where are the hotspots or high-risk areas we should be aware of?
Yeah, well, in the province of KwaZulu-Natal, from last month, we have experienced the surge of rabies mainly in 3 districts, which is your Durban district, the district of we call it King Cetshwayo district in the areas of Richards Bay, and there's Ilembe district, which covers areas such as Indwedwe, Bhamshela, Maphumulo. That's where we lost a 2-year-old boy in that area because of the dog bite. So as a consequence of that, as a department, we have escalated our campaign, massive vaccination program that we are rolling out, in particular in those affected districts, but throughout the province. We for the next 6 months, we will be going door to door. We will be working with local authorities, your councillors, and so on, in ensuring that we wipe out rabies as they were. So from time to time, weekly, every day, we ensure that we get statistics in terms of the level at which we are making the impact. And we're hopeful that in the next 6 months we will have done that. So today was a symbolic expression, because this is a day, an international day of rabies, where the MSA was leading the campaign from the front in terms of ensuring that we raise the awareness, but at the same time we vaccinate throughout the province.
Khaye, we understand that effective rabies control is really threefold: active community participation, education and public awareness that you've mentioned, and then access to mass vaccination of dogs and post-bite treatment. How are you doing as a department on the score of education and public awareness, especially in the rural, remote areas where we lost a child to rabies recently?
Well, we have noted that before, our levels of communication and awareness were not probably to the extreme as it would have been expected. And as a result of that, we have escalated our effort in that regard. We are now working on radio adverts, community radios. We are engaging directly with communities, doing door-to-door, but also we're working with traditional leaders in terms of community mobilization, where we interact directly and communicate directly with communities in community halls, in sports ground, in various areas, in the deep rural areas of the province, so that the message reaches even in the most remote areas of the province, where many of our people have many dogs that they just breed for recreational purposes. Some of them use them for catching wild animals. So we are going to those areas much more. Our state vets are leading from the front in terms of communicating, explaining. We have simplified flyers that we are distributing. I must say that the relationship between ourselves, councillors and traditional authorities has been good so far, and we are hopeful that in the next 6 months we would have covered the entire surface of the province.
Yes, Khaye, just on that note, you've actually preempted my next question. How cohesive a response are we seeing between the Department of Health and Agriculture and traditional leaders, of course, because a collective effort is needed to combat a disease like this, and not working in silos or simply passing on the responsibility to each other?
Yes, indeed we are working with the Department of Health in the province even at the level of districts, we are working hand in hand with the Department of Health, because anyone who gets a dog bite, immediately health professionals must intervene and stabilize that person as and when that is reported. So that message has been going through, especially in the area of Lembe where we lost the life. We go together with the health officials as we explain these matters. They explain exactly how does it look like when someone has got a dog bite, and what are the forms of intervention that they do, so that people will know that the next stop becomes a clinic, a nearest clinic or a hospital at a point where somebody has been reported to have a dog bite. So that relationship is quite good, and we are consolidating it throughout the province, because you really can't work without the other with regard to such a particular epidemic. So we are hopeful that in the next few months we will have surmounted this particular epidemic, as it were.
Khaye, very quickly, we're out of time. The location of your vaccination spots in Durban today, where can members of the public bring their animals to?
Well, we are in Charles Cross, which is an area that is near Chatsworth. But also, it's important to say that the program is being rolled out in these hotspots. The other program, the other areas of focus is Indwetwe, Mapumulo. There's areas of Ishowe, which is close to Mpangeni. There's a program that is being rolled out there. In Palito, where there's been cases reported last week. Also, a team there of state vets are also intensifying the vaccination program in those areas. As and when there are areas that are reported, we will be there on the spot. But also, we are leading the way where cases have not been reported, in ensuring that we prevent them by vaccinating the dogs in the main and the cats.
Thank you. That was Mr. Khaye. That was Mr. Khaye Nkwanyana joining us from our Durban studios, the Provincial Department spokesperson there. Thank you for sharing your insights with us on the SABC News.